Hi, my name is Micah Wills, and this is my maple syrup urine disease project. Clinical presentation and symptoms of disease. Okay, so this disease is detectable like right after birth, within the first week or two, during infancy or early childhood. As well, you can smell the urine and smell the sweetness of it, and you know whether or not a child has MSUD. But other symptoms can include lack of energy, vomiting, poor feeding, abnormal movements, hallucinations, and delayed development. Delayed development is really crucial, and we're going to talk about that later. If left untreated, maple syrup urine disease can lead to seizures, comas, eventually death. It can lead to learning disabilities and severe lack of bodily control. We're going to get into that. But children can live healthily until adulthood if treated properly and addressed quickly. It's mostly about making sure that your protein is restricted, because this disease attacks your genes that help break down enzymes, and if you can't break down enzymes, you can't consume cheese, meat, dairy, or eggs. So that's really what this attacks. If you have MSUD and you get sick, or you fast for a long period of time, or you eat outside your dietary restrictions that are given to you by your doctor, you can endure a metabolic attack, which is an outburst in your metabolism. It's an outburst in your metabolism and can lead to brain damage and other issues. So here we have normal urine, MSUD urine, and you can tell, like, it's definitely syrupy looking in both pictures. We also have a normal brain and an MSUD brain, which is lacking in nutrition and obviously not thriving the same way as a normal brain, and we'll get into why. So the mode of inheritance is definitely autosomal recessive no matter what. Both parents carry the mutated gene, but they could never show signs of the condition. They could just be carriers, or they could show signs in their early childhood, but that's pretty much it. Unless they full on have MSUD. They're going to pass it on to their children. There's 25% chance per child. 1 out of 4 of their children will most likely have it. So the genes involved are BCKDHA, BCKDHB, and DBT. They are polypeptide genes, keto acid dehydrogenase, alpha and beta peptide genes, which is really important to note because they're primarily involved in breaking down enzymes. So MSUD is caused by these genes. DHA, I'm just going to name them based on their back half. DHA is located in chromosome 19 on the long arm, band 1, region 3, and subband 2. DHB is located on chromosome 6, long arm, band 1, region 4, and subband 1. DBT is not as commonly affected, but it is affected, and it's located on chromosome 1, short arm, band 2, region 1, and subband 2. So Next, we have the protein and biochemical explanation. Now, because BCKDH is the alpha, that's what the A is for, and BCKDHB is the beta. They are pretty much one and the same. It's just that the alpha is more common. And the more common case of MSUD is the most severe case. So the most severe case happens to also be the case where the child is diagnosed right at birth. That's when it has to be treated immediately, otherwise it would affect the child's entire life. They're also both called the E1 components as well because of their enzyme complexes. And DBT is an E2 component. Their BCKDHA is an enzyme complex in the mitochondria, just like the DHB, and they're all three actually responsible for one step in breaking down amino acids. So the three amino acids they're responsible for are leucine, isoleucine, and valine. And those are called BCAs. They're in milk, eggs, and meat. So basically, this whole disease is like being allergic to all dairy, eggs, and meat. It disrupts the function of normal enzymes in breaking down amino acids. So it basically stops amino acids from breaking down altogether. So where do they go from there? They go nowhere. They plug up your system and you basically are stuck feeling terrible because your system is not functioning properly. It's like a blood clot in a way, and it causes a ricochet of just horrible events throughout your body. And as they build up, they create a toxin that mostly affects your nervous system more than anything, which is kind of interesting because this is mostly located in the digestive system, and it affects your nervous system so much. So here we have where the BCKDHA is actually located. B is also located around the same area, but this is just a small example. And here you see that the BCKDHA and B complexes, this is how they normally function. They break down the BCAAs, which are the leucine, isoleucine, and valine. But they also, but when you have MSUD, they don't break them down. So we have the additional mode of inheritance. So basically, the buildup of enzymes commonly creates pancreatitis, which I looked up, and it contributes to symptoms like weight loss and vomiting and nausea because it's literally inflammation in the pancreas. Which also affects gastrointestinal issues. So your gastrointestinal system starts to create acid reflux, and then eventually you're throwing up and having lots of diarrhea because you just simply can't hold any foods down. The enzymes cause lots of neurological problems. We talked about that. So here we talk about brain degeneration. So we have ataxia, which I looked into, is the lack of muscle control or coordination that involves like walking, throwing a ball, simple things like that. You can't do it because you're always like shaking, or you involuntarily throw things. sort of like Tourette's, but not quite. Because you're, well, very similar, but I can't quite get into detail as to what makes them so different. But also seizures. So that involves loss of movement. Now there's also hypertonia. Hypertonia is like a stiffening of the muscles, where there's too much muscle tone because the lack of protein causes your muscles to just stiffen up. And then there's hypotonia, which is low muscle tone and reduced strength because of, once again, lack of protein. So these are common, and they contribute to developmental issues, shorter legs, skinnier arms and legs, bigger head, thinner hair, grittier looking, yellower teeth. It contributes to those types of things. Now, in severe cases, cerebral edema will occur, which is fluid in the brain. It doesn't matter what area. It can cause tons of problems. It can mess up your optic nerves. It could completely change your speech patterns. It can alter your memory. That liquid on the brain can alter pretty much anything. And it can lead to comas, hallucinations, drowsiness, because it's essentially like swelling on the brain. So here we have a normal brain, and here we have a fluid-filled brain. There's like little movement for air in here, whereas there's more movement for air in here. And that basically disrupts the function of a child. You can't really think as well, can't move as well as other kids. It's bad. So frequency and distribution. So I had to do a lot of research on this because this affects one specific group of people, and it's not even a specific ethnic group. So here we have MSUD affects 1 out of 185,000 babies worldwide. The most effective group is this old order called the Mennonites. They're Christians. They were established in the 1560s. They believe in adult baptism and not like baby baptism. They're mistaken for the Amish oftentimes because of their clothes and their beliefs in like certain fabrics. They believe God is the answer to everything, and 32% of them live in North America. Now you may be thinking that's a small amount. That's actually the biggest concentrated amount of them in one single country. Most of the countries, there's only about a 1% to 10% ratio. And so the most effective group is them, and 1 out of 138 babies are born with MSUD, which is a large amount of children. Amongst the Mennonites that live in just Pennsylvania, 1 out of 176 are affected. And imagine that one baby will marry another one baby that happened to have it, and so on and so forth. Like they'll produce. It's a lot of the community is affected by this. So here we have diagnosis and screening. So the easiest way, as I said before, to identify MSUD is the urine that a baby first produces within the first week or 2 of life. You can smell it. But if they have intermediate or intermittent MSUD, they won't usually show signs until the toddler years or like elementary school years, which is early childhood. In this case, a blood test can be done, but the blood test is not traditional. You look at a dried blood sample on like a piece of cotton, and doctors try to see if there's like amino acid buildup from that blood. Mostly leucine, because it affects you the most out of the 3 BCAAs. MSUD can be detected in white blood cells as well. And in prenatal diagnosis, they do blood tests, but they do them from the chorionic villi cells and cultured, I'm sorry, the name just escaped me, amniocytes. Essentially this is the outer, the chorionic villi cells come from the outermost fetal membrane of the embryo, which is shown here. They come from this area. And the cultured amniocytes they come from the amniotic fluid, as partially said in the name, and the fluid is what the fetus lives in, and they collect that fluid, and that's how they test whether or not a child has MSUD. So, I'm sorry. So here we once again have the sample, because this is also how it's detected in children. Okay, so treatment and management. The only way to officially get rid of MSUD 100% is a liver transplant. And even then, it's actually not 100%, because you still carry the gene and you have to go through gene therapy afterward. But you no longer have the active parts of the gene, so you can eat normal food and function as a normal person, but you will be a carrier for the rest of your life. Like I said, the most common and severe version happens within the first couple weeks of birth. So usually IV glucose and IV or nasogastric feeding tubes are placed to give a child the nutrients they need and adjust their amino acid levels. Later on in life, after maybe a metabolic attack, somebody might go through hemofiltration or hemodialysis to get rid of excess amino acids, and they're filtered through blood plasma, and then returned back into the body with just lower amino acid levels. But most people just manage this disease, and by that I mean that they eat healthily. They maintain a restricted diet. Just no eggs, cheese, dairy, most meats. They primarily eat fish and like protein powder supplements. It's important to also have a specialist with you, like on your side, in your corner, because when you go to the hospital for a flare-up or a metabolic attack, they'll be right there to help you through it, or they'll walk other doctors through it to get you out of the hospital quicker. So someone with MSUD might get like a fever or something, and they can't keep food down, like I said, vomiting, the diarrhea. So they have to be hospitalized immediately, and that's when they might receive one of these 3 treatments. And here is an example of the nasal tube and an IV. And here's a dialysis machine used to filter your blood. Okay, so in the future, so here's the thing. There's really no FDA-approved drugs out here for this, because this disease implies a lack of mitochondrial BCKDC, which is used to break down amino acids. So you're lacking this gene to break down amino acids, are BCAs, isoleucine, leucine, and valine. And there is no drug out here that could really help with that. Most clinical trials deal with phenylbutyrate. It decreases BCAs on its own, so it basically picks up what you lack. And it's added to sodium, sometimes like straight up just salt, but it's added to sodium, and that sodium is added to protein powders, and that's what they give to patients that they're testing in clinical trials right now. And they get their blood tested every few hours for like a couple of days and weeks. It's usually like every 2 to 4 hours, maybe even 2 to 6 hours. They'll get their blood drawn just to check and see how their MSUD amino acid response is going. Results are very different. Some people respond extremely negatively, and others respond extremely well. But the most common issue is gastrointestinal pain and sometimes muscle pain. It hasn't really truly been proven to decrease the number of BCAAs in a drastic level. So it's not conclusive enough data. Not enough people have successfully went through the trials to push it forward. In a study on Hereford calves, they're a breed from Great Britain, they showed that by switching the C to a T in the BCKDHA gene, introduced a stop codon into the protein's leading peptide. So it basically stopped MSUD altogether. But they tried this in mice and they just died. So they went ahead and changed the T to a C, and it kept MSUD levels low, and they didn't have any metabolic flare-ups, but there was no significant decrease in BCAAs. So, other information. So I really connected with the one question that was put out. Does this disorder and its treatments raise, I think, larger societal or ethnical questions? I think it does. I think that people are so used to being like victims that they think that these ailments and stuff that people have now are cool. So like depression has become like a trend now. So now because eating gluten-free and stuff is celebrated as a really healthy lifestyle, people have been like eating gluten-free very often, even though they don't need to. But most people are like, oh my gosh, that's so dumb. Why would you eat like that? That's not necessary. That stuff doesn't even taste that good, blah, blah, blah. My mother has celiac. We go to gluten-free restaurants all the time. Gluten-free food is pretty great. And I believe that people should think more about others than themselves and be more open-minded to food sensitivities and allergies, because people with MSUD can't eat eggs, milk, and cheese and meat. So what are they going to do? They need something to supplement that, and they should be included in restaurants and things like that, fast food chains, all of that. So we should find more ways to accommodate people like that. I mean, people with peanut allergies can't have Chick-fil-A, and I feel like Chick-fil-A should fix that. And I feel like there's so many other oils they could be using besides peanut oil to make their stuff taste good. Same with Five Guys, and I feel like this applies to this. I feel like people require special foods, and we should just accommodate that. Now, I'm not saying like, oh yeah, every restaurant should have a gluten-free menu, but I feel like, it's 2020. Many of them should have a gluten-free menu at this point. So many people have just switched over just because, and my mom can't help it, but I mean, lots of people have just done it just because. And we should have more sections in grocery stores for people with issues. Like, yeah, we might have like one section in a Giant, but like Giant is pretty mainstream. I feel like all stores should have some type of gluten-free options, or more vegan-esque options, because MSUD people basically live like vegans, um, or vegetarians. So what I found most interesting about this disease is that it can be detected days after birth. So like you can detect it quickly, so you can squash it pretty quickly. um And I thought it was crazy how many neurological issues it could cause, even though it was in the digestive system. And I think I said that earlier, but man, that's a lot of things it could cover. Like, there's so many issues that you can get just from lacking enzymes. Um, and you have to get a liver transplant to get rid of it, but it still just makes you asymptomatic. Like, you still have it for the rest of your life, and that's kind of crazy to me. Um, Now, while I was researching, though, I did have questions about Mennonites, because they were a very specific group mentioned all the time. Um, I tried to find answers as to why they were affected so heavily. Like, I looked at their point of origin, and like all of those things are mostly from Northern Europe, but there are plenty of religions that came out of that area that just simply reject cow milk and say like, oh, only goat milk and no beef. But they don't actually have an allergy like this. Like, they don't have a disease like this that'll literally make them sick from this. Like, this is just basically targeting one specific group of people. It gave me mostly regions and not really like countries, which wasn't specific enough. I also wondered if the neurological damage MSUD causes happens to relate to like mental illnesses. So if you're getting fluid in the brain, if you're having seizures and things like that, like, would you eventually develop a mental illness, like ADHD or schizophrenia or Asperger's, or something of that nature? Um, because it's kind of implied based on the symptoms of this disease, like hallucinations apply to schizophrenia. Um, I don't know if I mentioned it, but attention span is also affected, and that contributes to schizophrenia and ADHD. Um, and it said could lead to developmental disabilities and issues and things like that. So I felt like it could probably go to that. So I really wanted to figure that out. Most sites mentioned like mental retardation, but they didn't really go into details as to what impairments that apply to. So like, I don't know exactly what they're talking about when they say mental retardation. Like, I need more detail. But these are my references. And yeah, hope you enjoy. Thanks for watching.